Okay, this video is going to go over a lot of the bony aspects of the pelvis. So we're going to start out by looking at an example of a pelvic fracture here. So you'll notice, again, the first thing that you want to be doing is looking at the left to right symmetry between the pelvic inlet here and then also each of the obturator foramina. And first off, you'll notice there's a very clear and hopefully obvious lack of symmetry in this patient. And so you can see an evidence of two different fracture lines around the obturator foramen on this patient. So one along the superior pubic ramus and then one along the ischial-pubic ramus down here. And then typically, if there's a fracture somewhere on in the pelvis on one side, there's oftentimes going to be a defect on the other, on the contralateral side as well. And so that's what we see over here is a disruption of the SI joint, contralateral and posterior to the location of the pelvic fracture down here. So again, that's a pretty common pattern. And once again, you'll notice that there's this clear asymmetry from left to right along the pelvic brim in this patient. So again, just by simply looking at the rim of the pelvis, or again, the pubic around the pelvic inlet, and then around each of the obturator foramina, it makes it relatively easy to be able to identify these very significant fractures in this patient. So some landmarks that you want to be aware of when you're looking at the bony pelvis include the iliopectineal line. So remember, that's going to be this line coming around this way. And so that's going to denote the limit of what's called the anterior column, whereas the ilioischial line is going to be forming the posterior column. So again, you kind of follow the ilium down along the ischium, and then the iliopectineal is going to be coming down the ilium to the pubic bone. So that's going to be this line up here. So again, you have the anterior and a posterior column. Then we also want to pay attention to the anterior and posterior lips of the acetabulum. This one can be a little bit tricky, I think, for some people to think about. And so in order to better appreciate that, before we look at it on the image, I want to go over to complete anatomy here for just a moment. And so you can hopefully appreciate this. So here we have the bony pelvis, and then you can see obviously the femurs, which have been, I shadowed them just so that you can appreciate this hopefully a little bit better. But you'll notice if I'm going to kind of rotate this around just a little bit here. So you're looking at obviously the acetabulum. You can see the head of the femur is highlighted in green on the patient's left in this case. And so you'll notice that the lips of the acetabulum are the borders of it. So here's the anterior lip here, and then the posterior lip is coming along back this way. So again, I'm gonna actually hide the femur now, just so that you can see hopefully a little bit better now. Okay, so again, if we kind of turn this a little bit, so there you can see the posterior lip back there and the anterior lip up here. And so on imaging, what you want to note is that on an AP view like this, note that the anterior lip remains medial relative to the posterior lip. Okay, so the posterior lip, you also notice the posterior lip has this pretty significant turn in it. So it sort of comes down, it's like the Nike swoosh sign in some ways. So again, it comes down and sort of does this loop down here. And the anterior one does that to some degree too. It has kind of a slight sigmoidal appearance to it. But what you can notice is if you look over on the patient's right here, where the femoral head is still in place. So here's the femoral head. So you remember that's going to be obviously sitting further in the acetabulum, which you'll still be able to see the cup of the acetabulum as well. So you'll see kind of this cup down here, and then cutting across the head of the femur, you should see, kind of running parallel with it, you should see the anterior lip, which again is more medial. And then coming down off of it here, you can appreciate the posterior lip of the acetabulum. Okay, so again, keep those two structures in mind as we look at this now. So coming back to the idea of this anterior and posterior lip. So first off, you can see the true acetabulum, so it's sort of the cup-like appearance to it. But then the anterior and posterior lips, you can see like the posterior lip kind of coming through over this way versus the anterior lip that's sort of cutting across the head of the femur, and then same thing over here. So remember, the anterior lip is always going to be somewhat more medial, whereas the posterior is going to be coming around here in a more lateral position. So those are going to be the anterior and posterior lips of the acetabulum. And then we also have what's known as the superior weight-bearing surface of the acetabulum, which ends in a medial teardrop. So you can see that happening right here. So as it comes down, you'll see this teardrop, kind of looks like a J almost drawn on the hip. And then here you see the mirror image on the contralateral side. So again, this is the superior weight-bearing surface of the acetabulum forming that medial teardrop. structure. All right, so now pointing out some of these structures. So the first one showing the first circle shows the obturator foramen on the patient's right. Here we have on the left the iliopectineal line outlined for you, and then that medial teardrop that I mentioned a moment ago for the superior weight-bearing lip of the acetabulum. Then we have the ilioischial line, which I mentioned before. So again, you can see that forming this posterior column here, coming around. So again, coming from the ilium down along the ischium. And then we have the anterior and posterior acetabular rims or lips, like we mentioned a moment ago. So again, this one's going to be the anterior, being more medial, and this is going to be the lateral one coming around this way over here. So this is a normal pelvic x-ray here. Hopefully you can tell that this is a female pelvis. So again, you can notice the oval and very wide appearance of the pelvic inlet. And you also notice the subpubic angle is quite wide, so greater than 80 degrees clearly. And so again, this is definitely a female. You can also appreciate the labia majora down here as well to help kind of confirm that this is indeed a female that you're looking at. All right, and then here we have the pubic symphysis outlined for you, and then the SI joint identified up here as well. And remember with the SI joint, you're going to be able to see two parts of it. So you're going to see the anterior and the posterior aspect of the SI joint. So don't be confused by that, where, again, there's two locations at which the SI joint can be pointed out. So. All right, and then we have the iliopectineal line once again, and then the ilioischial line. So again, the anterior column versus the posterior column. Here you see the acetabulum, and then the acetabular lips with the anterior lip right here, and the posterior lip coming around down this way. Pelvic inlet or pelvic brim is outlined for you up here, and then each of the obturator foramina are outlined down below. One of the things I was going to point out on this one too is to notice that there is asymmetry in terms of the size of the obturator foramina in this case. And so what likely happened in this image was the patient wasn't perfectly aligned with the imaging plate, and so as a result, with the shift, it just makes one obturator foramen look a little bit larger than the other. So they still look relatively symmetrical. It's just size is a little bit different. So in this case, it's unlikely that there's any sort of fracture that's the cause of that asymmetry. And then finally, looking at an imaginary line known as Shenton line. This is a line that can be drawn along the inferior border of the superior pubic ramus. So you can see that coming along up here. And it continues down along the head and neck of the femur. And so this line should effectively be smooth and continuous along its entire course. So once again, if that's not smooth and continuous, that indicates that there's a high likelihood that there's a fracture. So it could be a fracture up here along the pubic ramus, the head, or especially the neck of the femur. You'll see that oftentimes shift, and that indicates the fracture is present. So pay attention to Shenton line when you're looking at this. And again, we'll talk a lot more about fractures when we get into the lower and upper extremity lectures here later on as well.